Good morning. Hey guys, it's Miss Ro. Thank you for joining my channel. Thanks for coming back. So today I'm just here just to rant and vent again. But something's been weighing heavy on me. And I just felt the need just to come on the channel and just talk about it. So I was talking to my cousin a few weeks ago, and she was going over some different illnesses, some ailments that she's been suffering with. And as you guys know, or many of you may not know, that I have experienced I have been diagnosed with stage 4 endometriosis, and as well as pneumothorax. And essentially what that is, I have very, very severe endometriosis that has spread to my right lung and has caused a collapsed lung. That was back in 2019. So I've had countless surgeries and been on different medications, etc., just to get better and get healthier. So my point is, for saying all of this, is when to get diagnosed with something that the symptoms sound so vague and can resemble so many other symptoms, it is crucial to document and journal all of your symptoms that you're experiencing. Right? You have to. That's what I was telling my cousin. It cannot just be a one-time thing. You go to the doctor and you just say this thing and then you don't see her anymore. You won't get a diagnosis that way. You have to chronicle all of your symptoms over a long period of time, and then take the journal to your doctor, and then you guys can come up with a diagnosis, or she could figure it out, or she could discuss it with, more of her colleagues or whatever. But one-time visit won't give you a diagnosis. So for me, these are the things that I experience. So maybe my symptoms may sound similar to what you're going through, and you can then, journal your symptoms and take it to your doctor and see what kind of diagnosis or diagnostic exams and tests that they'll do. So for me, my symptoms started back in 2006 or 7. And every month I've always suffered from severe and extreme menstrual cramps. I would live on 800 of Motrin around the clock every 12 hours. In addition to that, as time went on, I would take 800 of Motrin with a Tylenol, and I would have to have a cup of coffee for the caffeine to help with my chronic headaches. Later on, as time went on, I don't know, maybe 4 or 5 years after that era, I started having right-sided chest pain. Nothing major, nothing that would stop me in my tracks, but I noticed every time I had a period, I had right-sided chest pain. And again, I would still take the same medication regimen, and it would help tremendously. As years went on, I started to get nauseous. In addition to the severe abdominal cramps, I had shortness of breath, but I never thought anything of it. I just was slightly short of breath. And then in 2016, I start working out a lot, and I start doing classes and swimming and lifting weights, etc., etc. And I noticed every time I had my period, I couldn't work out. I was extremely short of breath when I worked out. After my period subsided, I could work out again, and my short of breath would go away. So I had to make note of that. Then I realized I couldn't, the end of 2016, I couldn't lay flat during my period. I could no longer lay completely flat. I would have to prop myself up on pillows. I had a little small hacky cough, nothing crazy and nothing consistent. The cough was actually inconsistent. I noticed I would cough sometimes, and then some months I would not cough. So the chest pain, the fatigue, I would get dizzy. Like I said, I had chest pain on the right side, the headache, the nausea, But most important, this was the telltale sign for me. As a healthcare provider, I knew I had air in my body. In 2017, I started having like Rice Krispie sounds, crackling. That's called crepitus. And I knew something wasn't right. I wasn't 100% sure. Maybe I was in denial. I don't know. But I had crackling like in my side. Sometimes I could feel it in my jaw, or I always had like a Rice Krispie, basically crepitus. So that's when, in the back of my mind, I knew I had some type of air. I still didn't know it was a 30% pneumothorax. So there you have it. And I still didn't get diagnosed until 2019. On a whim, but that's a whole nother story. If you want to hear my whole diagnosis and how I got diagnosed, it was at work, a whole uneventful situation. I had no clue. Went to work a regular day and left and was at the hospital. But if you want to know more about that story, leave it in the comment section and I'll get on later and tell you the story. But you guys, the point of this video is journal your symptoms. That's the only way you're going to get a diagnosis. Please keep a record of everything that you're going through, what you ate, what medications worked, what symptoms you experienced this month, what symptoms you didn't have this month, etc. Okay? So I hope that helps. I hope my symptoms help you, and I hope you're able to take it to your doctor and you get some form of help. You guys, stay strong and hang in there. Bye.